Well, neighborhood family practice has grown consistently through the years. We started as a very small office with just originally one doctor and one staff person, and now we have so many doctors, nurse practitioners, and nurse midwives that I lose track. We have 100 staff members, over 100 staff members altogether. And the community, the number of patients who seek care from neighborhood family practice has grown as well. We now see, I believe, over 15,000 patients a year.
Rather than starting with a framework of what has the best reimbursement or what's the trendy new thing in healthcare, we are all about care in the neighborhood based on the needs of the community. For example, we've really expanded our women's health program over the past 10 years because we realized that there were not a lot of high quality options for women who were having children or needed family planning services and other women's health services. So we really expanded that in response to community need that we identified, both from what people were telling us and the data.
If you look back to the beginning of neighborhood family practice, the words weren't there, patient-centered medical home, but we were doing that work from the very beginning. Again, putting the patient at the center of the care, involving community resources, really getting to know people and having people feel that they knew us. A friendly, welcoming place is what we've always offered, and I think every medical encounter should take place in that kind of context.
The care team model, the model of the patient-centered medical home, starts with a trusting and caring relationship between a medical care provider, a doctor, a nurse practitioner, and the patient and their family. And then it builds out from that.
There's a huge stigma with mental health. Still, even though it's better than it used to be, there's still a big stigma. And having behavioral health in the same exact area, building, hall as the rest of the patient's care, the patient sees behavioral health as just another piece of their health care, which it is.
A lot of times you'll see midwives with OBGYN doctors or midwives who have their own practice, but the primary care and midwifery care together is really unique. What that allows is for neighborhood family practice to really do comprehensive care for families across their entire lifespan.
The way we've kind of developed the program is that every patient, really, regardless of their health status or income or whatever it is, they can really benefit from our program because it's very flexible. And I think that's one of the big parts of it, is that it is flexible, like I said, that it can be tailored to each patient, but at the same time it's general enough that every patient can benefit from it.
Well, recently we've had the refugee clinic join our array of services. And this is a wonderful program in which we are able to offer services to the refugees who are being settled in Cuyahoga County. We do their screening exam, and then we offer them comprehensive care for their families once they have settled.
I view it as a privilege to work with patients. Patients come to us with tremendous hurt and pain in their lives. And I believe as a clinician that my job is to have one leg or one foot in the pain and the difficulty that people experience, and the other foot or the other leg to be in the sunlight, and that's hope and the possibility of future and better things. And so I feel very passionate about the work I do because everyone deserves the opportunity to be heard. Everyone deserves the opportunity to know that they're okay.
Once you get engaged with neighborhood family practice, there's no question. I mean, you want to belong, you want to be there. It's more like a family. Not, it's funny because I'm on first name basis with my doctor. My doctor is Dan now. And so when I talk about, my doctor, it's like, well, Dan, and people are like, first name basis, what, what's that all about? But you have that rapport, which is really, really nice.
When I first heard of them, I had just gotten pregnant with my daughter, and they had opened up on Store Avenue, which was close to where I lived. And I was happy we finally had some place around the neighborhood that I was able to go to.
Coming to neighborhood family practice, it's important for me because it helps me take care of myself, my health, and it's also a bilingual setting that I can come to, and they can explain to me better what options I have to take care of myself.
When you're going through a rough time, like deaths in the family and stuff, they're able to lend an ear and to talk to you about what's going on in your life, which I think that is very helpful.
Mm-hmm.
It's like a friend. They're your doctor, but they're also your friend at the same time.
If you were to see me 8 months ago, I wouldn't even be sitting here looking at you having a conversation. I never liked the way I felt. I never liked the anxiety that I felt, and just having such bad luck with doctors, I just gave up. I learned to deal with it. And my sister said, you know, you've really got to go see them. I've been seeing them. They're great. I love them. I just bit the bullet one day and thought, okay, I'm going to give it a shot. And the very moment I met everyone here, they were very kind, very nice, made me feel comfortable. I felt like I could talk to them. I mean, I just have nothing better. I don't have anything negative to say about being here at all.
I think, first and foremost, that I'm just honored that I get to work with all these doctors and all these nurses and all these very well qualified professionals, that they put me in this position to counsel their patients on how to improve their health outcomes, because what I do does in a lot of ways benefit the providers, and whatever benefits the providers benefits the company as a whole. So I'm very honored that I can be an integral member of that team.
Really means a lot to me to be able to serve women and to really help the women who are my neighbors and who really deserve to have a care provider who really cares about them and really understands what their issues are and what they're going through and what the neighborhood is like. And I think I gain just as much out of the relationship with the women as the women gain from what I have to offer.
We are so fortunate to have right now a federal grant and also very generous support from a number of our private foundations in town. If that foundation support was to dry up, I would have to really pull back on a lot of the service that we're able to provide for patients.
Well, if it wasn't for them, I still would never, I don't think I ever would have gotten the help that I needed. It's amazing the way that my life has changed, and I have love and respect for myself, and that was something that I never ever thought I could have.